Okay, good morning, good evening, based on the time zones that you're joining in from. This is Priya Sahni, Vice President with the firm focused on the healthcare practice, joining in from Gurgaon. And I'll also let Astha introduce herself.
Thanks, Priya. Hi, everyone. I'm Astha Malik. I'm practice director here at Everest Group, tracking the healthcare and life sciences market. And my focus is more on the provider side of things, and I work very closely with Priya.
Great. So let's give our audience a few minutes to join and would love to learn from the audience. Where are they joining in from? Please feel free to add that in the comment. So, Astha, what are we really going to talk about today?
So, Priya, well, the intent of today's LinkedIn Live is to talk about Agentic AI because that has been the talk of the town. But I think while we are giving folks time to join, maybe we can just, talk at large what we are seeing happening in the healthcare industry, maybe apart from Agentic AI, because a lot of regulatory changes are also happening. So, any thoughts from you on what will be the impact on the healthcare payers and providers from the regulatory changes that are happening?
Yeah, no, I think that's an interesting question, right? Agentic AI is definitely on top of mind for all payers and providers in terms of what kind of operational efficiencies or long-term impact it can bring for them. I think some of the other bills, like the Big Beautiful Bill, as well as the Medicaid spending cuts happening, the other regulations coming in around price transparency, quality management, even prior authorizations are definitely keeping the payers and providers on. I believe there's still some bit of uncertainty, but in amidst provider margins shrinking and more pressures coming in from the providers, there's definitely going to be more scrutiny around any spend. But it also means that some of the rural hospitals, etc., already sitting on thinner margins, might face even more pressure, which might ultimately get transferred onto the payers, resulting in increasing premiums, etc. But I believe there's, apart from all of these things, there's also a lot of caution because in terms of the clarity, we don't really know, how the next 6 months are going to pan out because the regulations, the tariffs, they still seem to be incoming. So that's at a very high level what I am observing. And I think there are a few people joining in from Hello Brand, but let's start into the main discussion that we have for today, Astha, which is more about agentic AI. And I cannot just emphasize enough on the number of queries that we have just heard on this topic, how it's really different from our traditional agentic AI, and is how is it really going to change the payer and the provider ecosystem. So let's start with, generally talking about the healthcare industry. I believe all of us know that, given the industry is at such crossroads and the traditional solutions in themselves are never really enough. And we always need more smart, more adaptable systems, etc. So, what do you feel? Let's start with, the general challenges that the healthcare organizations are facing today.
So, Priya, I think you touched upon some of those challenges in terms of the regulatory overhaul that is happening. But I would say that healthcare industry at large is, I think, in the middle of a storm, right? There have been those traditional challenges in terms of rising cost of care, clinician burnout, staff shortages, then, of course, the concerns around cybersecurity threats and data interoperability challenges. Those have been some of the traditional challenges that the industry at large has been dealing with, right? They have been there in the past, they are still there, they most likely will be there for a foreseeable future. And on top of it, now payers and providers are finding themselves in the middle of this regulatory overhaul, right? So that's also adding another layer of operational and margin related issues, right? From a top line and bottom line standpoint, both. So I think that's creating like a double whammy effect for payers and providers both. And I think you alluded to it a little bit in while you were asking this question, right? That it's no longer simply about automating or putting simple analytic solutions to the play or just putting bodies into the mix to solve for these problems. You need intelligent solutions that can actually solve for some of the bigger and systematic challenges to make progress, right? So I think that's where we'll lean towards, and that's where we'll see the pivot happen slowly and gradually. Yeah.
Yeah, I think that makes sense. And, relating to whatever you've mentioned so far, technology will definitely make a more role than even before. And there's a lot of talk of the town around agentic, but let's start from the basics. What it really is, and what do you feel is really agentic AI and how it's really going to change our ecosystem?
So I think it's important to talk about this primarily because a lot of the things that we're seeing being called agentic AI are not really agentic AI, right? So it's important to also understand the evolution of AI and how agentic kind of differs from your traditional automation. And if I look at it from at least the past 2 to 3 years, right? 2022 and 23 is where the chatter around generative AI came in. 2024 almost went into that chatter with a lot of POCs and use cases coming up. Towards the end of 2024, we started hearing about agentic AI, and now in 2025, it's slightly started to become more real, right? But I think what is different in terms of when we speak about agentic versus say, traditional automation is the fact that traditional automation is static, right? You have a specific set of rules and codes, and it's supposed to work in that particular set and code, right? It can't truly be autonomy, and this is where it kind of differs from agentic, because agentic by contrast builds on the fact that it is autonomous, right? But it's also important to understand that right now we are not there, right? We are maybe in a very initial stage, but autonomy is where it differs from say an RPA. Maybe if I were to make it more real, I would say that uh, a simple robot in a supply line, right? That would be automation. But think of a surgical robot, right, which is performing a surgery, and in the middle of that surgery, depending on how the patient is responding, they are recorrecting and changing their course of action. So that's where agentic AI kind of comes into the picture. I hope it kind of makes sense, because it's very important to actually understand that distinction, right?
Yeah, no, I agree. And as you were talking about it, there were a few thoughts coming in my mind. If I think around how traditional automation and analytics has worked, it used to use a lot of the data, but then independent decision making was something that it could never really do. I think that's where agentic AI came, where it could use a lot of the existing data, but then also curate net new solutions, etc. for you. And I think, but what used to still happen with generative AI is it's still going to sit on that solution. It's not going to go ahead and take the next step for you. And that's where an agentic AI is going to come in, that it's not just going to use the new solution on whatever your generative AI has really created. It's also going to now go and take the next step there. And let me take, an example of a patient from a post acute care kind of a setting, wherein while your generative AI can create all the medication programs for them, do all the coding, etc., create the charts, etc., for them. What agentic AI is going to do is then it's going to actually reach out to the patient, provide them access to what are going to be the post-operative steps, what are the medication adherence programs that it needs to adhere to, and if there is going to be a lag in any of those, or if agentic AI kind of sees there to be a need for a further intervention, that's something an agentic AI can do. So I think I would call it out like you are sitting on a lot of the data, you are generating a lot of the stuff. But what was really missing in our prior analytics models was nobody was really actioning upon all the advice that we had, and we still required a human to actually action upon that advice. Agentic AI, at least in its entire successful form, would be able to actually take the next step also on its own. But on that note, I would also have a question for our audience. Where do you feel agentic AI can play the maximum, can play the most impactful role in healthcare? In which particular setting do you think that's going to be possible? Okay, till the time our audience is writing on it, maybe Astha, going back to some of the points that you were mentioning, let's also correlate it with how do we feel agentic AI is going to really impact the healthcare outsourcing?
That's actually a very good question, Priya, and I think it's very important to not look at the progress we are making in terms of technology without overlaying it with the industry context, right? Because if you look at healthcare at large, it's if not the most one of the most laggard industry in terms of adopting any technology, right? And it kind of stems from some of the challenges we were initially talking about around very siloed systems, and of course there's also the sensitivity around data, right? So uh, if I were to kind of classify the impact it will have on healthcare and healthcare outsourcing, I would say that traditionally uh, the outsourcing that was happening was very FT dependent, right? Everything was more centered around creating opportunities through labor arbitrage and ensuring that cost kind of comes down through scale. Then we slowly and steadily started seeing uh, incoming or maybe embedding of more technology solutions from just point solution standpoint, right? Which work could be like automating a specific process in the entire workflow. And that's where I think largely the industry today is, right? But I think with the Agentic coming into picture, slowly and steadily, and I don't see it happening in the very foreseeable future, but eventually I do see that we'll move to a more outcome driven concept, and the lines between the tech and the BPO side of things, which were initially very very crisp, they'll slowly start to blur, right? Because agentic will create that autonomy, and the uh, FT or the person will kind of take that expert position, right? So technology and FT or people will need to work together. So the silos between BPO or tech will kind of erode eventually. I think that will be the overarching long term impact of agentic coming into the healthcare outsourcing world.
Yeah, yeah, no, I think that makes sense. And I think, again, the human in the loop thing, we've been talking about it for a very long time now, but I believe it will get a lot more crisper here, because if you think about it, we are talking about how agentic AI can really impact your clinical decision making, medical coding, prior authorization related stuff. So while your agents would be doing a lot of these things, how your human in the loop comes in and makes the actual process really integrated and
Yeah.
actionable for the end user, I think that's going to be the mark which would really differentiate a successful from a not a very successful solution. Any questions that the audience has for us, please feel free to write in the comment section. And to that extent, let's move on to the next thing that we want to talk about for today. So, while we've talked a lot about how it's going to really have an impact on your outsourcing, etc. But I think it's also important to think about where we are today in terms of our agentic AI capability progress, be it
Hmm.
in terms of where we are in terms of adoption, implementation. And honestly, that also takes us back to the question around where we were all the way in our generative AI technology adoptions, etc. So, any thoughts on that, Astha?
Absolutely, Priya. And I think this is a very important question because, while we see use cases coming, and we've seen tons of use cases come for generative AI as well, right? But I think uh, how the progress is happening from awareness to pilot stage to production stage, that's a whole another story, right? And in terms of the capability progress that we are seeing happen from an agentic AI standpoint, I think this slide which is currently up, it kind of explains it very nicely, right? So I think everything kind of exists on a spectrum, be it agentic AI. So I would classify the progress of agentic AI also in terms of these four agents which are there, right? Task agents, quasi agents, true agents, and then the self-governing agents. And their borderline underlying capabilities or defining features are around goal orientation they have, the level of autonomy they can achieve, how quickly they can adapt, whether there's a multi-step collaboration happening, whether they can learn, right? So these are some of the underlying, I would say, characteristics that define each of these agents. And I think if I were to specifically talk about where we sit today, I think we are somewhere leaning towards or moving towards the quasi agent state, where there's a little bit of collaboration happening between agents and they can talk through systems, but the level of adaptability, self learning, and self governance, that's less, right? So goal orientation is less, but I would say multi-step collaboration is definitely happening, right? So true agents and self-governing agents, I would say that's where true agentic kind of comes into the picture, where there's more focus on goal orientation, how quickly we can activate that feedback loop, learn, and how we can adapt. And then self-governing agents, I would say they that's like the north star we want to achieve, where we can actually call an agent a digital colleague, so to say, right? But I think right now we are far from there. We are somewhere between creating task agents and moving towards the quasi agent state, I would say.
Yeah, and on that point, Astha, so I completely agree that we are really away from a time where we are using the true agents or a self-governing agents. But
Yeah.
what is really going to take for us to move from these task agents to the true agents and self-governing agents? I'm sure there's going to be more infrastructure level changes also that really need to make there. So, what do you think is really going to enable this shift?
So Priya, I think again it kind of stems the fact that we are here kind of stems from the fact that there are certain challenges that healthcare industry has been dealing with for a while, right? And it is centered on data, right? Because if you don't get access to your point, which you were saying earlier, right? If you don't get access to the right data, you can't action it, right? So the fact that there's very little interoperability, of course, now there's push to kind of uh, make that happen. I think we're still far from there, right? And if your systems can't speak with each other, agentic cannot truly perform to its true potential. So I think one would be overcoming that interoperability challenge. The other would be, I think, also ensuring that our models are less, I would say, reliant or less affected by the hallucinations that are happening. Because in our industry as uh, sensitive to data leakage, or where we handle so much sensitive information, I think that will become a very important factor, and that's kind of will drive, if we are able to solve for that, that will drive the adoption of agentic in the future, and maybe fast track it also.
Yeah, and then that note, I think what we also need to do is move away from the systems of records that we have as of now and really move towards systems of execution, because I think that fundamental shift is actually going to be the enabler for a lot of the agentic AI related use cases that we are going to just talk about. And I believe, there's a comment that I see with the recent commitment from the leading six payers. Prior auth will have a great use case of agentic AI. I think we completely agree. Prior authorization still seems to be the greatest adopter of generative AI, of agentic AI, even if in its current setting, and with more commitment coming in with more interoperable solutions, better API related connectivity, us using more electronized systems for collaboration between the payers and providers, and all of it, in an attempt to reduce down the overall admin cost and denial rates, etc. What it really means is that prior authorization is an area which is definitely very, very ripe for agentic AI adoption. On that note, I know let's start with talking about where do we really see adoption happening. I know in terms of the art of the possible, there's a lot that we can talk about. And I would love to say that a lot of the solutioning of medical treatments can be done by agentic AI, but we all know that's not really going to be true, at least for the next few years. So, where can agentic AI really make a mark, and what would be those leading use cases for us to focus on?
So I think this is a good slide to talk about here, because it kind of tells us the progress that we've been able to make thus far in terms of even use cases moving from consideration stage to the production stage. And while I know that this is around generative AI, I think this can be used as a proxy to also understand that we are in a very initial stage, right? And this is a survey that we did, I think, around uh, end of last year, early this year. And if only under 10% use cases in generative AI have been able to move to production, I think it's safe to say that in the agentic AI world, while there's a lot of buzz, I think the movement to production is fairly slow. And of course, it can fast track because of certain commitments happening from the payer side. I think that's what Anand's comment was around. And yeah, but I think if I were to talk about some of the top use cases that I'm seeing on a provider side, I think one is prior auth that we touched upon, but I would say also around scheduling, right? Because that has been a relatively problematic area, right? Because there's a lot of back and forth, a lot of wait time when you need to schedule an appointment, right? So that's also another area that we're seeing gaining traction from an agentic AI use case point of view. And of course there's coding also, which is kind of seeing an uptick. But these are some of the areas that at least I'm seeing on the provider side. Priya, if you could also share something that you are seeing on the payer side happening in terms of the use
Yeah.
case that are going to.
Definitely, Astha. Let me, touch upon what I am observing happen both from the payer and provider side. But before that, Mahendra, I think your point is very accurate that if you really compare the hype to what's actually gaining ground in reality, there's a lot of difference. And I think this slide also mentions in that in terms of the real numbers, because if you really see in terms of whatever is being tried out versus what is really moving to production, there is still a lot of gap between the two. And in agentic AI, because it's still in its initial stages, we don't really have those systems of execution really implemented. It's actually going to take even more time for us to be really able to implement that true agentic AI. I think hence becomes more important for us to realize which use cases are going to have a more real shot and will also help you with a better ROI. Because see, honestly, from a provider and a payer's perspective, it also really needs to bring that kind of a ROI for them to even investigate in some of these areas. So before I move into what are the specific use cases which I believe could really become prominent or be good use cases for agentic AI adoption, probably a question for our audience is what would be that one use case that you feel can be the best shot for agentic AI adoption? Probably that one area where you would place your bets. Would love to know your views. But if I really think about it, I think some of them, Astha, you already mentioned, which are around your appointment scheduling, etc. You think of the entire process, it can really take away the role of any actual people required in that process. Even if I think of the medical coding, etc., kind of areas, there's going to be very less role that humans would have to play. If I think of things like clinical decision making, I don't think it's really going to replace the physicians in any way. But in my mind, I'm thinking of a situation where a clinician is really sitting in an emergency room and all the required data, etc., to provide the analysis is real time being provided to them. So it's more like a real time assistant that you can have that is helping them make all the real decision, and that could really improve the efficiency of a clinician that is sitting out there. uh, we can also think of how treatment plans can be created by agentic AI, but again, it will go back to the challenges that we again discussed for even things like generative AI, wherein while you might be able to create those solutions without a human in the loop, it is still going to be more difficult. But where it can still play a much better role is that your current CRM platforms can help define a journey for your member or your patient, but then they are not going to really reach out to that member, right? That there was an appointment 3 weeks back, you really missed it, or why don't you go for your annual health checkup now, or we really see your symptoms deteriorating and you really need to go back and look at what's really going wrong, or there's a medication that was provided to you by your clinician, but I don't see you really adhering to it. So I think those kind of use cases which a traditional CRM was not actioning upon, and agentic AI can truly make a difference in those areas.
Absolutely.
Okay. So I think now that we've talked so much about the use cases, let's maybe start with some use case. Let's maybe start with what do we feel would be the long-term vision for agentic AI, or where are we ultimately going towards?
So that's actually a very interesting question, Priya. And it's like I have a crystal ball, but I have my hypothesis. But I think that I think the ideal state would not just be thinking about agentic AI in terms of an intelligent, adaptive technology. I think the end goal should be about creating an intelligent healthcare enterprise, right? I think that should be the ultimate North Star, and that kind of alludes to the point that you were mentioning around how some of the CRMs today cannot action upon certain things which can actually be actioned upon if agentic AI kind of comes into the picture, which is kind of the foundation layer of what we call the movement from SOR or system of records or engagement happen to system of engagement execution, right? So I think that's the ultimate North Star, that you want to create an intelligent healthcare enterprise which is standing on system of execution, which is actually a self-governing system which is built on agentic AI, which can actually action a lot of things with uh, rather than for people following an SOP or a specific guardrail. They actually take the role of an expert and make sure that the uh, productivity is not just focused on making things efficient, but it's about fast tracking things and focusing on hyper productivity, so to say, right? So I think that would be the end goal, to create an intelligent healthcare enterprises, and not just looking at adoption of an agentic AI in silos or just from technology standpoint. At least that would be my aspiration if I look at adoption of agentic AI in healthcare.
Yeah, no, I completely agree. And as you were saying, while we are really away from a time where actually agentic AI is going to be used, I think we are starting to see some initial success out there. But it would still it would really take us to work on a lot of the backend systems, etc., to be able to really reach there. But there are definitely use cases around prior authorization, etc., which could still really get changed with the leverage of agentic AI. So I think what we can do is, let's go. That also brings us to the end of this LinkedIn live. And if the audience has any questions for us, please feel free to reach out. And we're also attaching a complimentary copy of the SOA white paper that we recently published, which you'll be able to access as a part of by clicking on the link in the chat. So thanks everyone for your time. Goodbye until next time.
Take care.
Thanks everyone.